My name is Egide. I'm a medical doctor and I'm a recently graduated at the University of Burundi. I'm also a community builder. I identify myself as a community builder, change maker, and SDG promoter. I can also add I'm a health leader and entrepreneur in the social business. I co-founded Village Health Action, which is a non-profit organization that is working in Burundi since 2012 in the education and health sector. Well, I've realized many things since I began my work in the community, and as we are operating in two sectors, health and education. For education, we have a program called Empower Youth through Vocational Skills, such as English skills and the computer skills program. We are cooperating with the U.S. Embassy in Juba, and they gave us a local academic and mechanical spaces where we can train students from all universities to access to computer literacy and the English skills. We have trained many people. We have arrived at 5,000 students trained in the English skills and 2,000 trained in the computer literacy skills. And we go in the universities and explain how people can do advocacy, how can work as volunteers to educate people in the diseases and the prevention, and how they can do social business and how they can be impactful in the community. Education is our behalf very important, and we put much energy in education, and we think with the youth who is educated, the country can move forward. And in the health sector, we have realized many things in the organization, and I have been very impactful with my team, so that we do free medical campaigns in the rural zone, the medical campaign in Jumbura City, where we go to the population, we educate, we center on non-communicable disease and infectious disease such as HIV infection. Our priority is health adolescent, and we also target youth general population because NCD target the whole population. And for leading views our voices program of NCDRS as part of Young Professional Chronic Disease Network, which aim to help people do the advocacy in UN high-level meeting by giving their views and their voices in this, and they take the participate themselves in the process of advocacy. And we do advocacy, especially in this country where there is poverty. These people deserve much better, and for essential medicine, for treatment, for prevention. And I'm correcting their views and their voices, and we put together with others in East African community so that they can present in the UN high-level meeting as their voices to be taken into consideration while elaborating a global strategic plan. And we have also another project which is a project of a global fund and executed by our association, and through ABS, which is an Alliance for HIV in Burundi, and CANCO, and a consortium of NGO operating in AIDS in Kenya, and it's a fund from Global Fund, and the project called HIV and Harm Reduction. The purpose is to reduce the harm due to unsafe injection, especially HIV, tuberculosis, and hepatitis, and sexual transmitted disease. These people, this category called the key population of people using drugs, whether injected or not, are vulnerable, and we are working together and with the Trooping in the center to have these people access to medicine and prevention skills and education. These are the projects we are doing in health, and apart infectious disease and the non-communicable disease, we did education, and we are operating to help people access to information and education and communication. And in health, we are doing what we call community-oriented research. We collect information, and we are in this process of building a data that the Ministry of Health or other organizations can use in the future when they are doing action plan or strategic plan, and not be considered for the future interventions that can work very good to tackle disease in this country, and can be used also to use it in this region, because disease have impact for not only for the country but for the whole region, as there is interaction with disease with human and animals. We have many challenges, but as problem solver and leader, we were working together with other people to overcome our challenges, and we hope we can do better. But the most challenges we have is funds. We are from a poor country, and sometimes we don't have funds to put in our project. For example, we have a small space in the English and computer literacy program. We would like to welcome many people, many students with access to our cities, but we don't have enough space that can contain enough students from all the university, and we don't have also fund to pay volunteers for coordinators, people who are doing their job to coordinate these tasks. Sometimes without being paid. So these are most of the challenges. Also about health sector, we have programs also fund, for example, for HIV and harm reduction project. These people need to have access to essential medicine. They don't have money to pay. Others have been rejected in their family. They are not working. They are living in the streets. We just give them psychological approach and some drugs we have, but we don't have enough medicine to take care of this patient, to help this patient. They would like to be more, for example, hygiene program and nutrition program, so that they can adhere to antiretroviral treatment. They can adhere also to other services that are very important to lead the project and be successful. These are many challenges we are doing, but the most are funds and where we can use the rooms we can need to work in, but we are trying to collaborate with many people working in the area, and we hope people are able to help us, and things gonna be well. Whereas UN have defined Sustainable Development Goal 17, I am here as young and change maker and medical doctor to build a healthier society and to make the world better. In 5 years, I will do myself to continue to educate people, to empower youth in different areas, and to create their own job, not to be job seekers, but to be job creators. And help out trying to sunset on a disease. I will create more spaces where people can discuss how solutions and intervention can lead to good actions, and I will try to promote sustainable development goals such as 7, which is affordable and renewable energy, because of the coverage rate of electricity in Burundi is 4, and we need electricity to do many activities in this country, and we cannot do any activity when you don't have electricity. We need to operate in this sector so that education and health can move forward, because they go together, because sustainable development goals go together. I will promote SDG, I will create social entrepreneurship, and I will help social business for the youth to be more competitive and be more impactful in their community. And I will dedicate my life in empowering youth and in promoting health and help people to create their own job and increase their opportunities. And finally, in this region where data are not found, and you can find diseases are there, but you don't find data. I will dedicate also in these 5 years to help build a big data for disease, and so that people can access to the data and they can lead the future intervention without a problem. Because it's very complicated when you want to tackle a problem, but you don't know the situation, you don't know the pattern, you don't know what is it's like. So it's up to me to do research and to make a research so that people can know the situation of any disease, any problem or any pattern they can try. And I'm here to, in these 5 years, to do research in the community, do research, also fundamental research, and help to build this data so that it can help people, decision makers, and non-profit organization and the government to put some intervention that can lead to good action and have make our country better, and therefore